So this is a short video what I just speak upon in the last 10 to 15 minutes. So the most importantly, now your scope is in the lateral compartment. You are viewing the tear. So if this type of moderate size tears, you might require a single medial anchor, especially a triple loaded or suture tapes. Because suture tape is nowadays it is more preferred because that will give uniform pressure across the tendon so that the tendon become more flat to the bone. And this is how you have to prepare the footprint area. That's how you improve the biology. The lot of bone morphogenic protein, protective growth factors, all will come from that marrow. That will help for your tendon healing into the bone. So once you properly debride the footprint, identify the ideal location for your anchor placement. Once you identify the proper place, you put your first stitch and take the stitches as mentioned earlier like this. Footprint is properly debrided. The tendon have to bring into this footprint area and tie. Especially in this type of cases, you can see what we have used here. There are two images being close together. One in case the first one we are using a 3 triple loaded anchor, and the other one is a Sironix tape, double loaded tape, and the lateral row what we are using a lateral row anchor. So basically, if you follow the steps, the first, second row slide you might remember, you have to go step by step wise. So know the anatomy, do the proper lace, put the anchors at the particular place, retrieve the sutures without any entanglement and without an untying of this anchor, and place it uniformly without tensions. You will get an absolutely better results and a better patience. Thank you.